So I want to take a minute to talk to you guys about some tools that we will occasionally use, and they're called muscle scraping tools. And so they come in various shapes and sizes. What people most often think about when they think about muscle scraping, so it's also called gua sha or iStim. Graston is a common name for it. The iStim is instrument assisted soft tissue mobilization. But most people think about maybe hitting some of the larger muscle groups, right? And going some deep tissue massage, some kind of deeper myofascial work. You're increasing blood flow to the area. Sometimes people will go to the extent where it starts to even cause bruising to the area. And of course, those are definitely causing vascular changes to the skin and some of the deeper tissue where you really are bringing some blood flow to the areas that may not have been used to that type of pressure. And so that can be a way to increase the tissue mobility, increase blood flow to the surface, increase blood flow to the skin, break up the tissue a little bit, maybe work on some trigger points. But another way to use it, and probably a way that I use it more often, is taking some of the smaller tools and working on the smaller areas, specifically the point where the muscle begins to transition to tendon and attach into the bone. And you can get some really useful desensitization that happens there, where we're helping to shift how the brain perceives stress to that tendon. And so what you would do is you would take that tool and you can scrape back and forth right at those transition points. So whether you're dealing with the elbow here, right, as it attaches into the elbow joint, maybe you're working that patella and quad tendons here. You're scraping back and forth. It doesn't take a ton of pressure here. You're spending a minute or two just working that tissue. You may need some lotion, and that can help things slide a little bit better. But what you're doing with that is, like I said, we're desensitizing the area. So we're helping to reframe how that body part is perceiving stress. And so tendons are used to taking tremendous amounts of load, and they should be able to handle tremendous amounts of load. And so when they are hypersensitive, we want to bring in something that is non-threatening, stimulate that area, stimulate those nerves, help them to see that there can be stress without pain. And so that technique is an alternate technique that you might try out here. Like I said, it's also still causing a little bit of increased blood flow to the area. We're also helping that tissue to slide and glide, but then attacking at more of a systems level where how the body perceives stress on that joint. If you know what you're intending to do, you can better be able to direct where you're headed. And so whether you are increasing blood flow, increasing tissue mobility, desensitizing the joint, here are some tools that you can use. You can use the fancy tools. You can also use something as simple as the blunt end of a butter knife. So lots of different ways of doing it out there. Hopefully this is helpful to kind of guide what you're doing. Hopefully it can be a tool that you can use to help you get back to doing what you love a little quicker.